All right, Mark. A recent study, Canadian study that was published in New England Journal of Medicine, they looked at the very large cohort of patients and doctors. And as you remember, years ago, the ACGME, the graduate medical office, came in and said the residents have been on call for more than 24 hours, or they're working more than 80 hours a week. They're dangerous because it can cause fatigue. They may not perform in the operating room, and they may cause complications within the 30 days after surgery. But this study says completely otherwise. Can you tell the people out there exactly what?
It's up in Canada where they could track every almost 2,000 physicians. It's looking at one night in the day of a physician, where if you operated after midnight and then the next day you have another case, how did that case do? And they're talking about elective procedures like knee and hip replacements, spinal surgery. And they concluded that after a month, David, the amount of complications, including death, secondary complications, infections, etc., wounds, those were not increased by a tired surgeon from the night before. But again, it didn't look at it long term over many months. I think here the key is that the study author thinks that surgeons, once they reach, say, your level, although I don't know any at your level, but let's just say your level, can control the clock well enough so that you wouldn't operate if you were overtired. I think that's where the study is going.
Yeah, I agree with you. And I think the key to this study is that the attendings, as opposed to residents, were looked at. And, of course, as an attending, if you're exhausted and you're fatigued, you never go to the operating room, and you can change your schedule. You can move the cases around. I can also tell you, and I will mention it today, that surgeons are like military, Navy, or Army. We are trained to really go through years of training and dealing with fatigue. The surgical residency is brutal. As you remember, we were pulling like 36 hours of call and trauma calls, etc. So to some extent, your body is used to it, and you can function under a lot of stress. And that's the difference between surgeons and medical doctors. Personally, I think like once a year, I may feel, the fatigue factor. And you've seen me talk to the patient saying that today is not a good day and we're not going to do the surgery. It's very rare that happens, but you always have to do the right thing for the patient, obviously.
Right, which I agree with everything you just said. I would add to that earlier studies did show that long term, it's probably still a good idea to get 6 hours of sleep a night or more.
100%.
We're not telling people out there, whether they're pilots or trained engineers or certainly top surgeons, to be sleep deprived in general.
Absolutely.